Morning, Adi. What are you up to?
Just been having some knee pain while I'm running, so I googled it and I'm rolling my ITB.
Have you spoken to Jim, the podiatrist, about your footwear?
No.
Have you spoken to Jacqueline, the EP, about how much you're running?
No.
And have you spoken to any of the physios about your strength or mobility?
No.
All right, we've got some work to do. Let's get your knee sorted. Come on, let's go. Hi, I'm Hannah Drysdale. I'm the Senior Musculoskeletal Physiotherapist here at Upwell, and I'm going to talk to you about knee pain in runners. As a runner myself, I'm all too familiar with the injuries that we face year in, year out. Runner's knee is a broad term describing several different causes of knee pain, the most common being patellofemoral pain syndrome. Patellofemoral pain syndrome is a term used to describe pain arising from the joint between the kneecap, the patella, and the thigh bone, the femur, the patellofemoral joint. The patella is designed to slide smoothly over the femur as you bend and straighten your knee. The movement of the patella over the femur is controlled by the quadriceps muscle, which is actually 4 muscles which attach from different parts of your thigh over your kneecap. The patellofemoral joint is also affected by the joints above and below, the hip and ankle. So if there's any kind of dysfunction of either of these regions, the extra load generally lands on the knee.
Ouch.
This means that we have at least 3 areas to focus on when assessing and managing patellofemoral pain syndrome: the hip, the knee, and the ankle. So where do we begin? With load management. First, and probably the most important part of your management plan, is to get a good understanding of what has caused this pain. Patellofemoral pain may seem to come out of nowhere, but the truth is somewhere along the line, the joint has been overloaded, and this is the cause of your pain. The patellofemoral joint is designed to tolerate bending, jumping, squatting, kneeling, standing, sitting, walking, and running. It can tolerate heavy and repetitive loads, but a rapid change in load can cause irritation of the surrounding soft tissue or fluid within the joint space. We really need to look at the whole picture when assessing total load. This means capturing what you're doing while you're running, but also while you're not running. If we can make some minor changes to a few different areas, you will very quickly see big change overall. Some common areas of changing load are running surface. The harder the surface, the greater the load. Are you running on the road or the footpath? Could you maybe mix it up a bit by running on gravel path or the nature strip for parts of your run? Hills. Running up and down hills puts a much greater force through the patellofemoral joint than flat ground. Even a subtle incline or decline will affect your knee. So see if you can find a flat circuit while we're working on unloading your patellofemoral joint, and then we can reintroduce the hills later. Speed. Are you monitoring your pace? Are you always running at race pace or trying to beat your PB? Sticking to a specific running plan with a set pace target will help balance your total load over a week or a month. Distance. Have you thought about adding up your total distance across the week? Runners often try to run longer every time, but have faith, you will benefit from adding some shorter runs to your week. You may also need to consider how quickly you've increased your distance. This should be done gradually and should be specific to your running experience. Footwear. Come to think of it, our podiatrist Jim has already done a great video on how to select the right footwear for you.
So you've tested your shoes now, and you know what? If they're not passing the test, that's okay. 3 things you can look for when you're actually buying new shoes. First of all, width. We want to make sure that when we're actually lining the foot up, your foot shouldn't be cramped. If you're having to squeeze your front of the foot into the shoe, it's going to be too tight and lead to some forefoot conditions like Morton's neuroma, and it can even lead to plantar plate injuries as well. Your foot should be able to spread out in the front of the shoe. The second one is stack height. Stack height refers to how much foam we have in the heel compared to what's actually at the toes. A normal stack height is 10 millimeters higher at the heel compared to the front of the foot. Some shoes will be 12, others will be down as low as 8, 6, and 4. Depends on the mileage that you're doing, okay? If you're your everyday recreational runner, we recommend, as a podiatrist, 10 mils higher in the heel compared to the front of the foot. The last thing we're going to look at is, do I buy a neutral shoe which has little to no arch support, or do I buy a supportive shoe which actually can have a little up to a lot of arch support? This will depend from person to person. The best way to find out is by having your shoes fitted or by having a gait assessment with a podiatrist. As a general rule, if you're fitting orthotics into your shoes, you should be putting them into a neutral shoe. Or that way, you're actually only getting the support you need from your orthotic. So always take your orthotics when you go to get fitted.
And finally, activity when you're not running. Do you walk up and down stairs all day? Do you carry a baby or toddler around with you? Do you spend a lot of time kneeling or squatting? Do you wear high heels to work? Do you sit with your knees bent or your legs crossed all day? These are all examples of non-running load that on your knee that will add up over the course of a day, a week, and a month. Once we get an idea of where you might be able to modify your load, we then need to look at your body and your biomechanics. Next, we have the assessment. So the whole lower limb needs to be assessed and considered when managing patellofemoral pain syndrome. Remember, we're looking at the hip and the ankle as well as the knee. So your physio will assess you thoroughly from top to toe and work out which areas of your biomechanics are relevant to your knee pain. Here are a few quick checks you can do at home. Let's start at the top, your hip and pelvis. When you stand on one leg, your lateral gluteal muscles are responsible for keeping your pelvis level and stopping your other hip from dropping down. Weakness of these muscles can cause a valgus force on your knee, affecting the patellofemoral joint and leading to pain with repetitive load. How can you check this at home? Face a mirror with your hands on your hips and stand on one leg. Does your pelvis drop down at all? Then try a single leg squat. Watch what your knee and pelvis does. Does your knee point inwards? Does your pelvis drop downwards? These are all signs that you need to strengthen these lateral gluteal muscles to help support your knee. Next, we look at your pelvic tilt. Stand side onto the mirror and wrap your hands around your hips. Fingertips at the front pointy bones, and thumbs on the pelvis at the back. Your fingertips should only be slightly lower than your thumbs. If your fingers are sitting a lot lower than your thumbs, this is called an anterior pelvic tilt. This can be a contributing factor to your knee pain as it causes the hip flexors and parts of your quads to shorten, increasing the compression and tension across the patellofemoral joint. A few simple cues and exercises can help improve your pelvic tilt. Think pubic bone to belly button or ribs to hips. Let's move down to the ankle now. Ankle stiffness is another common way to overload the knee when running. If your ankle can't flex enough, you will land with a stiff knee and this will increase the load on the patellofemoral joint. It is important to be able to absorb and disperse the shock when your foot hits the ground. Come to think of it, Jim's also demonstrated a great way to assess and manage your ankle stiffness at home using a ruler.
Now, what you're going to do, you're going to go home, you're going to grab your old trusty ruler from the pencil case. What I want you to do is put it down on the ground and we're going to measure the flexibility of your calf, but also the range of motion that we're getting through your ankle joint. So we've put the ruler on the ground, it's right up against the wall. What we're going to do, you're going to lean forward, touch your knee to the wall and keep your heel on the ground. We want to try and get as far away from the wall as possible until your heel starts lifting off. Now, when your heel starts lifting off, I need you to tell me, are you feeling it through the back of the leg, down at the bottom of the heel, or in the front of the ankle? It's really important for which exercise we're going to do next. So lunge forward, and I go, okay, my heel's coming up from the back of the leg. So we've just done our lunge test. Now, if you're getting anywhere from 8 centimeters or above, we'll find in a general population that is what we consider a normal range of motion. Now, if you're finding you're below 8 centimeters, there's a couple of different things that might be restricting us. If you're feeling like in the back of the calf, if you're feeling it in your heel, chances are your calf muscles are so tight that it's causing your heel to come off the ground earlier. Now, contrary to that, if you're feeling it in the front of your ankle, you might have a bony blockage or some connective tissue that's actually restricting your range of motion.
Calf strength. I know calf raises are boring, but they are so important for runners. The jury is out on exactly what constitutes adequate calf strength and endurance, but ideally a long distance runner should be able to perform 25 to 30 good quality single leg calf raises. See what you can do. Stand facing a wall and rest your fingertips on the wall, but don't lean on the wall. Try and keep your chest the same distance from the wall throughout the exercise. Stand on one leg, count to 3 as you raise up onto your toes, and then 3 on the way down. Keep the movement slow and controlled, and make sure you go full range down and full range up. Count how many you can do on each leg. You might be surprised. Management time. So now we have a really, really good detailed knowledge of your running load, your non-running load, and your biomechanics. We can put together your management plan. So the best evidence we have for treating patellofemoral pain successfully is a combination: physiotherapy, load management, targeted strengthening exercises, targeted being the key word there, and correction of foot posture. Physiotherapy. While your knee is sore, you will benefit from some manual therapy to address the above findings. This will include massage and dry needling to reduce the muscle tightness around the hip, the knee and the calf. Mobilization techniques to reduce any ankle stiffness that we may have found, and taping techniques to support and offload the patellofemoral joint while it's sore. Reducing pain is a high priority early on in your management. Pain changes the way we move and creates compensatory patterns. These compensations can cause other areas of the body to take on more load, creating issues elsewhere. We expect the odd niggle here and there when we run, but pain that is felt on consecutive runs or is still present 24 hours later needs to be addressed sooner rather than later. I'll now show you a handful of exercises you can do at home to help your knee pain. TFL. Trigger pointing this little muscle up near your hip can affect your knee for a few reasons. 1, its tensioning effect on the ITB. 2, its action as a hip flexor and internal rotator. And 3, its effect on your pelvic tilt. So I like to use a lacrosse ball for my own self-massage. I just find it's a good size and a good density to get into the spots that I want to get. So use the little ball, find the 2 pointy bones at the front and the side of your hip, pop it on the ground and then rest on top of it, and you'll definitely know when you're on the spot. You can just rest there for a period of time, or you can roll back and forth, side to side, but make sure you're on the ball for a good 60 to 90 seconds to actually get any change in muscle length there. And I like to do this either before I'm doing my exercises or even before I go running, just to help reduce that tightness up around my hip and allow me to get into a better position of my pelvis when I run. Side lying hip abduction. Remember when we looked at your pelvic control standing on one leg? Strengthening your hip abductors with your knee unloaded is a great way to start getting some better stability across your hips and reduce that inward motion of your knee. We're going to strengthen our hip abductors in a side-lying position to begin with. I like to use a towel under my waist. It just helps to keep the pelvis and the spine neutral, and a band around my knees just to give some resistance. You can always start without a band if you want to, or if you find that it's a bit too challenging with the band. So lie down on your side with the towel under your waist, and then find a nice neutral position so that your hips are square. That's important. Keep your bottom leg a little bit bent and stretch your top leg out straight and get it back in line with your hip so that you're pulling slightly back and slightly upwards on the band. Next, you're lifting your leg up and down. You can use your hand here to feel that you're not using that TFL muscle that we just worked on releasing. And you can even pop your thumb around the back of your hip just to check that you are using that gluteal muscle that we're trying to access. Do about 20 of these, but that will depend on your endurance. And then have a rest and repeat that 3 times. Posterior chain bridge. So strengthening your hip extension and pelvic tilt control will help improve your push-off and reduce the tightness of the hip flexors. Bridging, another great exercise to get the posterior chain involved. Start lying on your back, have a band around your knees, preferably if you've got one. If you don't, it's okay to do this without. Tuck your pelvis under, really feel your lower back flatten against the floor. Squeeze your buttock muscles and lift your hips up towards the ceiling. Once you get to the top, have a look and check that your ribs are not flaring upwards. So the ribs are sinking down and you're using the backs of your legs, not your lower back, to create that lift. You can hold there, you can open against the band or against the air if you don't have a band. And you would progress this exercise by moving into some single leg lifts, raising one foot up and down, as long as that feels okay on your knee. Hip hitch. This is probably one of my favorites. So progressing your hip abduction strength into weight bearing will help prepare you for lunging and step ups once your knee pain has reduced or resolved. This is also a really great way to increase your body awareness and control around your pelvis before you run. Stand on a step where you can hold on to something for some balance. You're going to be standing on the leg that you're trying to work, and we want to keep accessing some of those muscles we just switched on with our bridging and our side-lying hip abductions. So right now I'm going to be strengthening my right hip by pushing down through my right heel and hitching my left hip up. I can use my thumb again to feel that I'm switching on the right muscle at the back there. And you can also just have a feel up around your waist to make sure you're not using your back muscles to create this movement. Try and keep your knee unlocked so it's soft, and hold at the top for about a count of 5, 4, 3, 2, 1, and down. Do this until you fatigue. You want to stop if you start feeling any discomfort around the front of the hip or the knee. Calf raises on a step. So you want to do this on one leg, but you can start on 2 if you need to. Make sure that they're slow and controlled, and then we'll finish with a little bit of velocity. So standing on the step again, we're going to take all the weight onto one leg. Try and stay nice and tall through your spine. Lower your heel down and then raise back up. Think of pressing through your big toe so that your ankle doesn't roll outwards. We'll do a few slow and controlled, and then we'll come to the top and do a few quicker pulsing ones to get some of the velocity that we need for when we run. It's worth noting that these are all exercises you can complete while your knee is still sore, as long as it feels okay while you were doing them. Once your pain settles, we really need to progress beyond these exercises to properly prepare you for the amount of running you want to be doing. So to summarize, what have we discussed so far? Patellofemoral pain is a common cause of knee pain in runners. The patellofemoral joint becomes painful if it is overloaded. This can be due to running load and non-running load. Stiffness or weakness at the hip or ankle needs to be addressed. To get the best results, your management should consist of manual therapy, load management and correction, strengthening exercises, mobility exercises, and correction of your foot posture. A combination of the above will have you back up and running in no time.